In this video, we'll explore the intrinsic muscles of the hand using cadaveric images. Let's begin with this specimen. Here you can clearly see the palmar aponeurosis, along with the palmaris brevis muscle. The palmar aponeurosis is a thickened, triangular modification of the deep fascia that forms a protective covering over the long flexor tendons and the neurovascular structures of the palm. Its apex, directed towards the wrist, continues proximally as the tendon of the palmaris longus muscle, while its broad base extends distally towards the roots of the fingers. From its medial margin arises the palmaris brevis muscle. On either side, the aponeurosis is related laterally to the thenar muscles and medially to the hypothenar muscles. If we move proximally, notice the ulnar nerve and artery, along with the tendon of the palmaris longus, lying superficial to the flexor retinaculum. Beneath the retinaculum, we can identify the median nerve in long flexor tendons. Now focusing on the palmaris brevis, this small subcutaneous muscle lies within the superficial fascia on the medial side of the palm. Also visible are the digital nerves, branches of both the ulnar and median nerves, and the fibrous flexor sheaths enclosing the flexor tendons of the fingers. In these slides, we've performed a deeper dissection of the hand to reveal the next layer of structures. The palmar aponeurosis, palmaris brevis, and flexor retinaculum have been carefully removed to expose the tendons of the flexor digitorum superficialis. You can see the cut edges of the flexor retinaculum, and within this region, the distinct tendons and muscles are now clearly visible. Starting from the lateral or thumb side, the tendon directed toward the thumb belongs to the flexor pollicis longus. At the base of the thumb, we can identify the thenar muscles, while the muscles at the base of the little finger form the hypothenar group. Between the flexor tendons, we can observe the slender lumbrical muscles. The first lumbrical lies immediately medial to the thenar group. The fibrous flexor sheaths enclosing the flexor tendons are also well demonstrated in this dissection. When we trace the structures proximally toward the wrist, the medial-most tendon is that of the flexor carpi ulnaris, while the tendon running towards the thumb side corresponds to the abductor pollicis longus. Additionally, the flexor carpi radialis can be seen lying deep to the cut end of the flexor retinaculum on the lateral aspect. To better appreciate the spatial arrangement and relationships of these flexor tendons, we will now move on to examine a cross-section at the level of the proximal phalanx of the index finger. In this image, we're observing a cross-section of the hand to study its internal structures in greater detail. The bony component seen here represents the cut section of the proximal phalanx of a finger. On the palmar or anterior side, the surface of the proximal phalanx appears flat, while on the posterior or dorsal side, it shows a convex contour. Within the concavity of the flexor digitorum profundus tendon, we can see the tendon of the flexor digitorum superficialis lying in front of it. On either side of these tendons, you can observe the cut sections of the digital arteries, which play a crucial role in supplying blood to the fingers. Now, shifting to the dorsal aspect of the section, we can identify the flat tendon of the extensor digitorum, which forms part of the dorsal digital expansion. This tendon is primarily responsible for the extension of the fingers. On both sides of the extensor expansion, the digital veins can be seen in cross-section. These vessels are responsible for draining blood from the fingers. This cross-sectional view beautifully demonstrates the spatial arrangement of the tendons, arteries, and veins, offering a clear understanding of the functional anatomy of the finger and its role in movement and circulation. This image illustrates thenar muscles. Superficial thenar muscles is abductor pollicis brevis. Partially seen muscle on lateral side is opponens pollicis. The muscle which is partially seen medial to abductor is flexor pollicis brevis. We can also appreciate the recurrent branch of median nerve winding round the flexor pollicis brevis. 4 digital branches of median nerve are also observed in this image. In this image, we're looking at the same specimen, but with a slightly deeper dissection. Here, the abductor pollicis brevis has been carefully removed to give us a clearer view of the deeper thenar muscles. On the lateral side, we can now identify the opponens pollicis, while on the medial side lies the flexor pollicis brevis. Together, these muscles play an essential role in the fine movements of the thumb, especially in grip and opposition. Also visible in this dissection is the recurrent branch of the median nerve, which can be seen winding around the flexor pollicis brevis to supply the thenar muscles. In addition, the digital branches of the median nerve are clearly seen extending towards the fingers, provide sensory innervation to the lateral part of the hand. This deeper view highlights the close anatomical relationships of the thenar muscles with the median nerve and its branches, emphasizing their functional importance in thumb movements and hand dexterity. In this image, we're viewing a further deep dissection of the thenar region, extending proximally. Here, the flexor retinaculum has been cut, and its cut ends are clearly visible. This allows us to explore the deeper muscular structures of the thumb. Near the base of the proximal phalanx of the thumb, on its lateral aspect, we can observe the cut ends of the tendons of both the opponens pollicis and the flexor pollicis brevis. Additionally, the tendons of the index finger have been dissected, along with the first lumbrical, to expose the deep thenar muscle, the adductor pollicis. The adductor pollicis consists of 2 distinct heads, the transverse head, which arises from the shaft of the third metacarpal, and the oblique head, originating from the bases of the second and third metacarpals and adjacent carpal bones. In this dissection, both heads are clearly visible, and you can see how they converge towards the medial side of the base of the proximal phalanx of the thumb, where they insert. This deeper view beautifully demonstrates the arrangement and orientation of the adductor pollicis, a muscle crucial for bringing the thumb towards the palm, an action essential for power grip and precision movements. Now let's move on to the hypothenar region of the hand. In this dissection, the medial most and most superficial muscle you can see is the abductor digiti minimi. This muscle lies along the ulnar border of the hand and is responsible for abducting the little finger away from the midline of the palm. Just deep to it, in the proximal part, we can partially observe the flexor digiti minimi, which courses beneath the abductor digiti minimi. On the lateral side of the hypothenar region lies the opponens digiti minimi, a deeper muscle that helps bring the little finger towards the thumb, an important movement for cupping the palm. Also visible in this image is the ulnar nerve, which can be seen dividing into its deep and superficial branches. The superficial branch is further seen dividing into the digital branches, which supply sensation to the medial 1.5 fingers. This view clearly highlights the arrangement of the hypothenar muscles and the important neurovascular structures associated with them, emphasizing their collective role in fine motor control and grip strength of the medial side of the hand. After studying the thenar hypothenar regions, let's now move on to the lumbricals and interossei muscles of the hand. In this specimen, you can clearly see the 4 lumbrical muscles, which are numbered from lateral to medial. The lateral most lumbrical, lying close to the thumb, is the first lumbrical, followed by the second, third, and fourth as we move medially. To display these muscles clearly, the tendons of the flexor digitorum superficialis have been cut, and their cut ends can be seen in the image. Now focus on the lumbricals. These slender muscles are closely associated with the tendons of the flexor digitorum profundus. An important detail to remember is that the first and second lumbricals are unipennate, meaning they arise from one side of the tendon, while the third and fourth lumbricals are bipennate, taking origin from both sides of the flexor digitorum profundus tendons. The lumbricals play a key role in finger movements, particularly in flexion at the metacarpophalangeal joints and extension at the interphalangeal joints, contributing to the fine coordinated movements of the hand. In this image, we're observing a deep dissection of the hand. All the flexor tendons, lumbricals, as well as the nerves and blood vessels, have been carefully removed to clearly expose the Interossei muscles. These muscles are located between the metacarpal bones and are divided into two groups, the palmar Interossei and the dorsal Interossei. In this specimen, we can identify 3 palmar Interossei and 4 dorsal Interossei. Let's first look at the dorsal Interossei. The first dorsal interosseous muscle is the largest and is situated on the lateral aspect of the index finger. Moving medially from there, we can see the second, third, and fourth dorsal Interossei, each lying between the adjacent metacarpal bones. These muscles play a vital role in finger abduction, helping to spread the fingers apart from the midline of the hand, which passes through the middle finger. This deep dissection provides a clear view of the arrangement and orientation of the Interossei muscles, highlighting their importance in maintaining the fine balance between strength and precision in hand movements. In this final image, the dorsal Interossei have been carefully removed to reveal the palmar Interossei muscles lying beneath. In this deep dissection of the hand, the 3 palmar Interossei muscles can be clearly appreciated. In this image, we're looking at a posterior view of the dissected hand, focusing on the dorsal structures to illustrate the dorsal Interossei muscles. To expose the dorsal Interossei, the extensor digitorum tendons, along with the dorsal digital expansions, have been cut. All dorsal Interossei are bipennate muscles, arising from the adjacent sides of 2 metacarpal bones and inserting into the base of the proximal phalanx and the extensor expansion. The first dorsal interosseous lies on the lateral side of the index finger, and in this view, the thumb can also be seen. Notice that the radial artery passes through the space between the attachments of the first dorsal interosseous, providing a useful landmark in this region. Additionally, the tendons of the extensor carpi radialis longus and brevis are visible on the lateral aspect of the wrist, while the medial most tendon, near the base of the little finger, belongs to the flexor carpi ulnaris. This posterior view highlights the arrangement and orientation of the dorsal Interossei and their relationship with the extensor tendons, radial artery, and other dorsal structures, emphasizing their role in finger abduction and hand dexterity.